If you're tapering off of a psychiatric medication and you start experiencing symptoms of anxiety, depression, tearfulness, irritability, etc., how can you tell if these symptoms are related to withdrawal from the medication or a recurrence of illness? Let's talk about it. My name is Dr. Ruth Doughton. I'm a board-certified adult psychiatrist. And historically, when these types of symptoms have occurred while a medication is being tapered or discontinued, it's been assumed that it's a recurrence of illness and that we have to restart the medication. But as we've come to learn more about withdrawal syndromes from SSRIs, SNRIs, and other antidepressants, so let's talk about 4 ways to tell the difference. So the first way is with timing. Usually with withdrawal, the symptoms are going to occur within days to weeks of stopping the medication. In some cases, there can be a delayed withdrawal syndrome. We're not really sure why this occurs, but it is a possibility. But in general, it's going to happen earlier on after discontinuation. With recurrence of illness, in contrast, usually these symptoms are going to occur weeks to months after the medication has been stopped. And then second tip is that when you restart the medication, if it's withdrawal, those symptoms will go away within a day or two, as opposed to recurrence of illness when it's going to take more time for your body to respond. The third point is that if you have associated physical symptoms, things like brain zaps, nausea, fatigue, headaches, muscle aches, then that's going to be a sign that this is more likely related to withdrawal than a recurrence of illness. And then lastly, if these symptoms are very different than the presenting symptoms that you had when you started the medication, then it's unlikely to be a recurrence of illness, right? You're not just going to have a new illness. It's more likely withdrawal symptoms. And this is important because the way that we manage these situations is going to be different. If it's a recurrence of illness, it means we need to go back up on the medication. If it's a withdrawal issue, it means, well, maybe we need to slow the taper, or maybe we need to go back up to the prior dose, hold it there for a little bit before we try and decrease again. If you have any questions about this, feel free to put in the comments below. Wishing you all good mental health today, and I'll see you in the next one.